This next topic is a very, very ultra super duper high yield, and that's the orbital versus periorbital cellulitis. Periorbitals, and they're going to give you a question that you have to distinguish: is this orbital versus periorbital? And there's one quick thing that you need to know about, and it's movement of the eye. That's the down and dirty of it. Inflammation of the lid and the periorbital tissue is what causes periorbital cellulitis, and it doesn't actually affect the eyeball itself. This can occur after trauma, a scratch, a scrape. It can occur from an infected wound or lid abscesses. You can also get it from respiratory infections or even a sinusitis. All of these can cause periorbital cellulitis. The majority of organisms that cause periorbital cellulitis are going to be strep pneumonia, the H. flu type B, and Staph aureus. You have to know these three organisms. The reason is that when you're going to start antibiotics, you have to start antibiotics that cover all three, so you certainly want to cover staph in addition to the first two. That's the important thing there, eyeball movement. So part of your physical exam is open, and sometimes the eyelid will be very swollen, so you have to kind of pry it open, and there could be some purulent drainage and all, but you're going to see that the eyeball moves. If the extraocular movements are intact, it's periorbital cellulitis. Go answer the question. Think of along those lines. Okay? And the treatment is typically just some oral antibiotics, but always cover for staph. Here's a patient with periorbital cellulitis. If you have them follow your finger, you will see that the eyeball moves. Easy diagnosis. Orbital cellulitis, however, is deeper layers. It can occur from a sinusitis that is extended outwards, and it causes entrapment of the muscles of the eye, and therefore the eyeball does not move. That's the important thing that you need to remember to answer your exam question. They can have proptosis, which means that the eyeball is actually bulging outward, and remember, the eyeball does not move. It could be from a wound that gets infected. It could be from sinusitis. The organisms are pretty much the same ones that cause periorbital cellulitis. Other terms, periorbital cellulitis is also called preseptal cellulitis, and orbital cellulitis is called septal cellulitis. So remember those terms and keep them straight. The best test, once you've got that suspicion, the eyeball doesn't move, you send the patient for a CT scan. That is your best test. And the treatment is going to be drainage of that area because it's entrapping the muscles, and antibiotics, always covering staph. So here's a patient with orbital cellulitis. If you get that eyelid open, you have them try to follow your finger, they're not going to be able to move the eye. This picture really shows it well. This patient, if you can get that the eyelid open, you will see that it's not really, the eyeball does not move. The eye is actually pushed forward. That's proptosis. And on a CT scan, a couple of things. First of all, this area right here is the sinusitis. This sinus is clear. This has sinusitis. It's extending out this way and entrapping the muscle. This is the optic nerve right there. But here's entrapping the muscle, and it's actually pushing the eyeball outward, and that's why you get the proptosis. This is orbital cellulitis. You need to drain and then IV antibiotics.